Ladies and gentlemen, welcome to another episode of Bants and Rants. Now, as you guys know, October is a month set aside for breast cancer awareness. And as we always do it on Bants and Rants, last year we did it, this year we are here again with a doctor to come educate us and tell us the things we need to know about breast cancer. So if you see this video and you're a guy, don't pass, because you also need, guys also get breast cancer. Fun fact. Guys also get breast cancer. You guys ask fact.
Oh, it's actually true.
No, but people don't know.
No, people don't know.
Fact. A lot of people don't know.
Doesn't know.
So don't think that this video is just for the girlies. You can also watch and educate your mom, your sisters, your wives, your girlfriends. So when you see the video, click on it and watch, because we are about to have an education session. Class is in session. Period. Now with me today is my very own personal doctor. I invited him here to come and teach us some things about breast cancer, what we need to know. And that's why you see us in pink. Yes. We are representing.
I think we look so good.
Yeah, we do. Everyone looks so good here in pink. So I'll let my doctor introduce himself. But we have Gifty, we have Ginger, and I am Techua. Can we know you?
All right, my name is Dr. Stephen Brook.
Dr. Stephen.
I'm a general practitioner at STC and Eden Family Hospital.
Okay.
Yeah. So
nice to have you here.
Thank you.
I'll be coming for full free.
Anytime you're ready.
Oh, period.
Okay, so guys, moving straight to it. What should we know about breast cancer? So today, all the questions will be at your side because we are here to learn. So if you guys also have questions.
But you are the guys who have the... Okay, no problem.
I also have
questions. You're the doctor too.
No problem.
Yeah, that's why you are here. Okay. So if you guys also have questions, you can chip in when I'm also like asking the questions. So to begin with, for someone who may not know much about breast cancer, what exactly is breast cancer?
All right. So in order not to bore you with so much terms like medical terms, I'll take it as a story. So let's say we are here, right? So there's a room, then we have the building, then we have other houses around. Now, cancer is just abnormal production of cells. Take it as that. Abnormal growth of cells. So probably you have a torn shirt, you need to go buy an extra one, you end up going to buy 100. You don't need the rest, but you end up going to buy it. That's cancer, basically. But you look at cancer with the breast, what happens is that the tissues of the breast get destroyed as a result of certain lifestyle activities. Now, when these tissues get destroyed, the body is prompted to create a new cell. But in the process of creating this new cell, what happens is that it ends up creating more than necessary. That's why I started with the scenario. Now, what happens is that when this new cell is created, or when these new abnormal cells are created, what happens is that it begins to spread. Okay, so now you just need 100, but now you have, let's say, you need 1, but now you have 100. You get it. Now look at, let's take it as a case where this room is on fire. What happens? You need to call, or you need to put out the fire right in this room. But you don't put it out in this room. You allow it to spread. So from here, it gets the whole building. It moves to the next house, all the way to the junction. Now, that is basically how cancer moves. So it starts from one individual cell and then moves all the way to affect other organs. Okay. I don't know if you get the explanation.
Yeah. So it can start as breast cancer.
Yes, starts at breast cancer.
Liver and
yes, it can go all the way to your womb, your uterus, your ovaries, your lungs.
So
your
it's
liver.
really affecting the reproductive
So
side. So
any organ, any tissue.
Okay.
Yes, it spreads. It spreads anywhere. So it can even go as far as your brain.
Oh, okay.
You get it. So that's why I said
I guess that's with the stages.
Yes, with the stages. So that's why I started with the fire scenario. So it starts just in this room. You get it. Then it moves. Yes, it moves from here. If you don't take, that's why in October we emphasize that you need to manage it. You need to detect it very early. A stitch in time saves 9. So you get it now. rather than waiting for it to spread, then it affects you.
There's
Yes.
nothing you can do.
You
But
get it?
then I don't think we should just wait till October because
October is that should be January.
So October is just to like create like more like a self-awareness. It's like Christians celebrating Easter.
Yeah.
Yes. You don't
Just
need
to remember.
Yes, just to remember that you need
there's
to do
something
this.
like
You
that.
get it?
All right.
Yeah.
But
Okay.
I feel like within every month, at least you have your
It should
own.
be part of like the regular
yeah,
checks at
something.
the
Yeah,
hospital.
something you should do.
Yeah, maybe we have some self-check. You
Yeah.
can
Yes,
check
self
it.
checks.
You
You
can
can do it yourself at home. Check it yourself, and then
You
make sure
can
that
let
you're
your
fine.
partner check it for you.
Well, yes, no, but some of them, if you get someone like Scanty, grab it.
Hey,
He will not do like just say send your baby me cry. Like breast cancer no cry. Like
You get it.
just say
Come on, come here.
like in Sempi.
okay. So how common is breast cancer in Ghana or Africa?
Okay, so statistics say that about 1 in 8 women
In
In
Ghana,
Ghana or
Yeah.
Africa?
in Ghana,
In Ghana.
1 in 8 women, and
Wow.
actually even in other investigations now, it's even 1 in 5
Hey.
in the US.
Okay.
Yes.
Yeah,
But
mashing me.
1 in 5. So I should count 1, 2, 3. All the ladies here, we'll get one person.
One
That's
person.
breast
That's how bad it is now.
Wow.
And it's all due to lifestyle, basically lifestyle.
I was about to ask. So does it mean that? But first of all, is it something you can? Is it genetic? Like
Yes,
maybe if
so-
your mother had a.
So
Okay.
the risk factors for breast cancer, first of all, if there's a previous history of breast cancer in your family, not even breast cancer alone, any cancer at
Okay.
all.
Oh, okay.
Yeah.
So
Okay.
your mom probably may have had ovarian CA. When I say CA, it means cancer. Your mom probably may have had ovarian CA. You might have had lung CA, a brain tumor, any of these malignancies.
Oh wow.
You can, once it's happened to your family, there's a potency
A
of
high
you
chance.
having
Wow.
it. Yeah.
Okay.
Okay.
But then what specific lifestyle change? Is it like what
Yeah,
like maybe
you keep saying
drinking?
The
lifestyle.
drinking,
Okay.
the smoking. Yes, I wanted to say something, but I don't like skin, tattoos.
Oh, wow.
All these things. Anything that would cause.
Hey.
That's why I didn't want to go there.
Wow.
Anything that affects a cell. The cell is the basic function
yeah,
unit
It's
of
the
life.
unit of
Anything
life.
that affects a cell, that your body will have to create a new one.
Oh.
That is
You get it?
interesting. I've never
Yeah.
heard that before.
So
Okay. So
sure.
I heard that weight also
Yes.
counts.
Weight also counts. It's all as a result of like your lifestyle activity that comes. You understand? Because now your body has to now find ways and means
So if
to
you are overweight,
you
means
get
you're not
it.
eating properly.
properly. Yeah.
Yeah. And also one time when I was coming to work, I heard on the radio they were also talking about it, right? The guy was like, in the Western world it's quite common there, right? But in Africa it's not really common. But then ours is aggressive when it comes.
Yes.
Because
So
I
what
guess they
happens is
don't
that
check it.
Yeah.
So what happens is that in the West, it's more common there because of the fact that they do more with processed foods.
Food.
Okay.
You get as compared to the sub-Saharan or Africa, where most of the time it's like you cook everything from the
Yeah,
farm
everything
and all
is
that.
cooked.
Yeah.
Uh-huh.
But the reason is that they pay more attention to their health, so they can detect it very
Very
early.
early.
You understand, and then it's seen. Someone in Ghana may have probably a nipple discharge and be like, "Oh, normal."
nothing.
Yeah.
Nyama be
You understand?
normal.
Yeah, they see it as normal.
Yeah.
In worst case scenario, the back sorry, on farm but
True.
hospital, you get it. So they do that, and then by the time you're able
Actually
to
go-
identify and
Yeah.
see
It's
it,
too late.
it's too late for you to
Yeah.
salvage anything.
Okay. So dog, does it have like an age where it has to start from maybe
Yeah,
the way
who can
we have
get
like
cancer,
menstruation
literally?
from like 12
13.
years to this time. So
So-
we have like cancer from this age to like that age, or maybe it starts from when you're like old.
So once you're a female, just know that you can have cancer. But the thing is that as you age, okay, so someone who is older, someone who will probably be in her 50s or in her 60s, may be more predisposed to getting breast cancer than
much
probably
more
you in your
likely.
20s.
Okay.
Yeah.
You get it. So the younger you are, you're safe,
A little,
but it doesn't
but
mean
that's
that
you
you
can't
can't
get
get
at
breast
all.
cancer.
Yeah, because I remember back in SHS, someone had breast cancer.
You're
she was
a
like,
student?
yeah, she was like 16 at that time. She had it.
You can get
So
it.
I was like really surprised. So, you know, what was going around? Like everyone was asking, is it like she is in her family, like just like what he said. Because me, honestly, I never thought you can actually inherit like breast cancer from like your. I
I've
never
heard that
thought.
before.
I never
Oh,
thought
yeah,
you
you
can
can,
actually
you
do
can.
that. Yeah. So
Okay, so moving into the symptoms and detections, like what are some early warning signs people should not ignore?
So, first of all, I'm sure this is the one that you all know, the lump in the breast. So you have a lump in the breast. Then you have the skin texture. So now you realize that your breast begins to feel like the texture of an orange. You see the peel of like the orange skin.
So like
You realize it's rough. We
rough.
call it skin dimpling. It feels
that's like
the dot.
the dot
Oh.
dots with the like it feels very thick on the surface. Yes, you have that. You have redness, and then you have what we call a caved-in nipple. So your nipple is actually supposed to be in a convex form. When we say convex, it's like round like this, but you end up having your nipple cave in, like it slides in,
Okay,
like
it
Ganacho.
goes inside.
It slides in. Then you have your discharge, the nipple discharge. So you see discharge, and then sometimes even the size. So you have one bigger than the other.
Yeah, that-
Yes.
But can you
That's-
have both at the same time? Like maybe having breast cancer
Oh, yeah.
like on both.
Both
So
breasts.
usually it will
breasts,
happen
yeah.
from one side,
then
and
Then
then
it
it will
moves to
spread.
the-
Yes,
the
it will
next.
start from one particular place,
Okay.
and then it will spread. And then sometimes you may not feel the lump in your breast; you feel it in your armpit, or what we call the axilla.
So that's why they start.
Yes. So you
yeah.
start usually when you
Oh.
are teaching, you are being taught the examination. You start from the armpit all the way into the breast. So for the men to most of the time, yes, Sechoa said men do get breast cancer. Yes, about 1 in 100.
Oh,
yes,
okay.
men.
So it's not as
Yes,
common.
it's not as common. It's very rare. But the thing is, the men usually will have the lump starting from their armpit
Okay.
or their axilla. Yes, coming down to yes.
Someone would think it's a boil.
Yes, that's the thing. They feel it's a lump, but you would realize a ball will most likely.
Be like a ball.
Yeah, it's more like a surface thing
Yeah.
as compared to a lump which will be found within.
within the muscles.
Yeah, within
Have you
the
had
tissue.
a case where a guy has breast cancer?
No, that's in my practical.
Okay. So what if in the case where you don't have the lump, you don't have the dots or the thing that's supposed to spread, you don't have like it turning red and all of that. We are just having discharge. Because you know sometimes in females when
you
you
give
are
birth.
not even giving birth, like when you are on your period, you sometimes get like
Nipple discharge.
yeah, nipple discharge.
Really?
Yes.
Really?
Yeah. Yes.
Well,
I mean,
some
yeah.
in medicine you can never say never. So
Okay.
there are certain situations where things can happen.
So what
So
do you
now-
make of that too?
Yes. So now
Maybe just
Yes.
check to be sure.
yes. So here's the thing: we have mastitis. Mastitis is just inflammation of the breast tissues, where you have an infection. Probably you had a cut or your boyfriend sucked it too much, and then you had a you got infected or something. So with that one, it comes with the redness, and then some maybe or not may have the discharge. But the thing is that we also have what we call inflammatory breast cancer. Now, inflammatory breast cancer doesn't come with the lump. So you can probably read on it when you're free. Inflammatory breast cancer. It doesn't come with the lump, but it would come with either the redness or just the discharge.
Okay.
So when you see it, you probably feel like, since there's no lump, because everybody's talking about lump.
Lump,
Yeah.
Since there's
yeah.
no lump, you probably feel like,
Yeah, see.
Then I don't have
yeah,
it.
I don't have breast
I don't
cancer.
have-
But you just go out and then check and be
Check.
sure.
But is that one easily treatable or is still the cancer now?
No, inflammatory breast cancer is actually the aggressive form of breast cancer. It's that because people don't pay attention to it
Okay.
since there's no lump. You understand?
So
And
that
then
one is
it's-
even more dangerous.
Dangerous.
Yes,
because you might
as
miss
compared to
it.
the one that you because you can identify the lump.
Okay.
Since the lump is there, you know you can identify it.
Yeah.
But you just feel like it's just normal. redness.
Normal, so you
And
wouldn't
most
pay
times,
attention to it.
most females, even medical practitioners, they end up confusing it for the normal mastitis I spoke about earlier.
Okay.
Because that is the infection. So
Right.
with mastitis, antibiotics can
Okay.
clear
Okay,
it.
can clear.
But you realize that you're giving the antibiotics and then still
It's
the
still
person,
there.
you could just feel free and go and check.
Then you have
That's
to have
all.
the mammogram.
Yeah, so mammogram is good. Usually when you have the lump.
Mm-hmm.
So we have the mammogram, we have the ultrasound where you go, they put the thing, the scan.
And then
thing.
Okay.
they look into
Yes.
it.
Then we have what we call the biopsy. Not every lump in your breast is cancerous.
So they'll cut some and then they'll
Yes,
test
the
it.
test
Test.
takes what we call a tissue, a biopsy, and then scan it for the cancer cells.
Okay.
I have had a mammogram before because I had a scare, but this was like a long time ago, and then it wasn't that. But yeah, so back to the lifestyle. I wanted to ask, so what if you pierce your nipples? Is it?
I mean, I never understand why people would pierce their nipples. Like, why would you?
Oh, sister.
Like, out of all places, why the nipple?
Hey,
Why not?
Life choices.
My question to you is, why not the nipple?
But I mean, you have your nose, you have your ears, you have
Honestly,
whatever, your
sister,
belly.
the nipples
Is this
not
cute,
pay.
Doc? What do you think?
Oh, come on.
It's cute.
We are moving.
No, but
on.
Doc, what do you think about
Nipple
nipples?
piercing.
It's
No,
cute.
it's well, fashion sense, yes, people feel it's fine, but
What about medical sense? It's
yeah.
dangerous.
you don't want to hear it.
You don't want to be told.
No, for the
so
audience.
I mean,
yeah.
don't you have, like-
it's actually harmful. It does more harm than good. Yeah, you're doing it for the gram, yes, for the like it's nice and then Instagram and all that, but you're also affecting yourself because
Yeah.
as I said, you've destroyed some cells when you were piercing. So now your body would want to create new cells, and then those cells can be
So
created
it can cause
abnormally.
breast cancer.
It's yes.
Yeah.
If
it's a
they
lifestyle.
sell-
Oh, that's so sad.
And I also heard of something. I mean, I think last week, someone was saying that if you have a partner, like a lady, you have a partner and he smokes, and right after smoking, he comes to like, suck your boobs or something, it can also lead to breast cancer. How true is that?
Wow, I can see that.
It's
You can see-
How true is that? I mean, when I heard of it, I was really surprised because I've never heard of something like
come
that
to
before.
think of it, it would be rare.
It's a
Unless of
stretch,
course,
yeah.
it would take a lot.
It would take a lot,
Maybe
yeah.
I'll feel forced to do it. Yeah.
Or maybe,
Hey,
I mean, like he
true.
constantly does it, like every time after smoking, he doesn't brush his teeth, and he comes
So
in.
as I said, probably you may have a cut because he smoked.
So
he
that's
smokes
how
his high.
some-
So
Yeah.
probably he would injure you in a way, and then that's how it will come about. Probably that's the best pathophysiology that could explain.
But it's not
that scenario.
something that it's
Yeah,
actually
it's a stretch,
studied.
yes, yes,
So
stretch.
right,
Okay, so Doc, how often should women perform their self-breast examination, and what's the correct way to do it?
Correct way.
And you have to
So-
trust. You
so-
do it yourself.
Me-
me, I'll do it. Yeah.
Scan to come and do it. So
Scanty.
usually, your breast is your breast. You are free. Do it anytime you want. At least once a month or so.
But
You
how?
understand?
Like
Often.
not like how often, but then as I sit here, I don't even know how to check.
Hey.
I'm telling you, I'm not even kidding.
Oh, me the tortoise.
Yeah,
My old place I
last
used
year
to work.
today.
Give us a demonstration.
Oh,
And I'll correct you. So.
Yeah, right. True.
I feel like it's a loss for yes. But I'll try. So it's like your hand has to be like 3 or
So first
4.
of all, you have to inspect. So you stand
so you
naked.
look at it,
stand
yeah.
naked in front of a mirror. Look at the sizes. Look at it. Is it? Admire your boobs. That's all right.
Is it looking? How are the
Yeah.
teeth?
Same
at?
size.
Is it
like-
abnormal
You
sizes?
stand
or
in front of the mirror. Look at it. In other cases, if you are not too sure when you're standing, you can bend. So you can bend. Look at it. You understand? Then you begin to. So Ginger, let's continue. So after the inspection, now come
So
to
your-
palpation.
Your hand, you raise your hand up and then you drag
Yes.
it to the.
So you,
this one.
you do
Yeah.
it in a circular motion.
Yeah.
Let's
Okay.
try to.
From-
some people do it like giddy.
Fast.
No, it
take
has
your
to
time.
be like.
Yes, because you need to identify even
Then you
the
move
tiniest
to the-
bits
yeah.
of lump. You get
Okay.
it?
Wait,
I told you I had a scare,
Well,
so
what-
I know.
naturally, there's some lumps in our
No,
boob.
that
No,
one
so those ones are
you,
dark.
yeah.
They are already there. They are
Okay.
like your.
So how different would that feel?
Yeah.
Oh, you will feel
No,
it.
you feel it.
You feel it.
You would always feel it. So you know the normal one, which is your breast duct, like your milk ducts, where breast milk will be.
Yeah.
Like
formed
it will
and
feel
all that.
different. That's
But
how she sees
usually
it.
it's yes,
And it will be-
it's
it will be
also
separated
attached-
from-
Yes, it's also
okay.
attached from the main.
Okay, so
one.
you
get
definitely-
it. Yeah.
Notice. Okay.
Is she done?
Oh
Oh,
no,
No,
that's
she's not done. She's not gotten anywhere.
No, could have to
Educational
sports. No,
purposes.
Yeah, so your hand is gonna be up, and then you do it.
Drag it
You have
from
to
the
do
armpit.
under. Yeah, you obviously drag it from the under. You have to do the under to raise the breast.
Sometimes
like-
it's best you lie down and
Yeah.
you do it,
And
so
do it.
at least it's flat. and-
So you come and do. So you raise this one to. You do the same thing. You press it.
You press the nipple?
Yeah, you
Yeah.
press the
Oh,
nipple. You have to
okay.
make sure
See,
that if there's any
Anything
discharge
will
coming
come
out.
Okay.
Yeah. And that's
Then-
So and then discharge, does it have like a color or something?
Once
maybe?
it's a discharge.
It's a discharge.
Just,
Yeah.
just
I think that's about it.
About breast cancer.
No, about what she
Did they?
Yeah.
Yeah,
So you
that's
do it,
it.
then you do for the other side.
Give me my accolades in the comment section. Thank you very much.
Okay, all right.
I know things.
Okay, so is it every unusual lump that is breast cancer?
So
As I
they'll
said,
test
no.
it.
So
if it's
it's not
benign
every
or not,
lump
yeah.
that's breast cancer. So we have benign tumors and then we have malignant tumors. So benign tumors are the non-cancerous tumors. They are just there probably because you did something, you hit your breast against something,
Okay.
and then the place is just hardened a bit or something. It's
For
normal.
like a short while.
But yeah, no, it's there, but it's
not
not.
cancer.
It's not
Okay.
cancerous, and usually they don't grow. It's there, the same size for over how many years?
Okay.
But with the malignant ones, it begins to spread. It grows. You get it, and then from the breast, it spreads. Most times, it goes straight into your lungs, then it descends.
That's
With the cancerous ones, it spreads from the
right.
breast into the lungs, goes down.
then that's where it starts
Yeah.
its operation.
Okay, so as we are wrapping up, the treatment and then management of breast cancer. What are the main types of treatment available for breast cancer, especially in Ghana?
Surgery.
Surgery. So even early detection,
Yeah,
surgery.
in early detection, that's the best.
have to take it
just take it out. Then we have chemotherapy, radiotherapy. I don't know if Kolebu they do the laser therapy, and then we have so that's the radiation therapy. So surgery, chemo, radiotherapy.
How affordable is it?
I don't think it's affordable.
Oh yeah, for sure.
That's why usually it's best you see it early.
Yeah.
And then, because usually the thing is, if you wait and then it spreads, cancer cells are sneaky links. Like they can move from the breast and go and hide. By the time you detect it in another
already
organ,
done.
it's already in
Late,
another
yeah.
organ. So probably it starts from the breast. By the time you are detecting it in your lungs, it's already in your liver. You find it in your liver, it's already going to your kidney.
Hey.
So the earlier
Then
the
that's why we
better.
have what we call the metastasis. So metastatic breast cancer. So it's spread throughout every single organ in your body.
Wow.
Wow.
Then that one you have to do more because now
And
you
when
don't know where it is.
when,
so
when
you
it
have
moves from here to like another place,
Does
it's
it move? It spreads.
It's
like
spread.
it's spreading
So it's
rather.
like- so it's
Okay,
like a
so
point of
then has
origin.
already affected one area and has moved to the other area and it's doing damage.
yeah, it's just going. So you realize that there are some people they go for surgery, one breast is taken off,
Yeah.
then they have to go again for the next
The
one because it's
next
already
one.
there. Then they take it off.
Breasts. Anyways, if it's detected early, can it be cured completely?
No, you can't cure cancer.
So wait, so even after
So if it's
it's
detected, you
taken
can
out,
just take it out. So,
Hey,
Yeah.
so they're taking it out, so I be done.
yes, so you take it out and
it's
then you
cured.
put
Oh,
yourself
that's
on
okay.
medications.
But
But you
sometimes
still have
they
to.
cut
but is there a guarantee that it's off?
Not
because it can
100%.
come back, right?
Yes.
It can come
So
back.
so a history of a previous CA can also be an indication for breast
Aye,
cancer
yeah.
again.
Yeah.
Wow.
Anyways, last one.
It's no joke then.
Last one
At
before
all.
we go.
A whole month has been dedicated to
I mean,
So you
just
know
the
it's-
breast.
you
So
should
you
know.
real.
what practical steps can women take to lower their risk of developing breast cancer?
people say suck your breast.
What
heard
is
that
that myth? Is it a myth? Is it true? Like,
So what happens is that usually we just want your ducts to be free because usually when there's a clog or probably there's something going on in there, then it can start from there. Usually that's why you say
but
suck
if I've
your
not
ducts.
giving birth, my milk.
No, I mean, it's
ducts
like-
not-
No, it's just it's a
inducing,
duct. Yeah, so
yeah.
it's
So
more like,
that's
yeah.
it.
So what happens is that, so what you need to do is your lifestyle habits, basically lifestyle habits. I always say that a stitch in time saves 9. Your lifestyle habits, cut down on the alcohol,
Right.
be self-conscious about your breast, and then pay more attention to it.
Attention.
You realize there's something going on. Don't wait or don't go and buy aboniki and those things and feel
Mami
like you're doing
Dagomba.
something. Yeah, then you see that people have lumps and they feel like, oh, Ebeko, like,
Right.
and no, just take it, pay attention to it, and then make sure that you're fine. So, basically lifestyle habits. If it's genetic, there's little
nothing you
you
can
can
do
do about
about
it.
it.
But most of the times, you need to pay more attention to it.
to your body and yourself.
And don't pierce your nipple.
Yes. Nipple piercing. Think about
Okay,
it.
do you girls have any more questions?
Me, I want to shout out like all the survivors. I knew somebody who
Right.
died of breast cancer,
Oh.
so R.I.P. Auntie Julie. But also shout outs to like all the
Breast cancer.
survivors.
The survivors, yeah.
And,
Oh, that's true. And then if you're free, make sure you go and test. There are so many places.
Is the testing expensive?
Which one?
Oh, you can. I feel
Like
like in
the screening?
October.
Oh,
yeah.
You know the funny
most
thing,
places are doing-
most places
Yeah,
are doing
places
it.
are
Even
doing
I
churches,
was at work.
even churches are doing
Yeah,
it.
churches
But
are
you
doing
know
it.
we don't pay attention
Yeah,
to it. Like
I think
I
So
was
just in October or like normal.
Do you
No,
have
I
one
mean,
you
okay.
can tell the audience?
like everywhere,
Yeah.
most people are all like everyone is doing breast cancer.
Mhm.
Sonotech is doing it at
Oh.
50% discount.
oh okay.
I think most scanned places are doing mammograms and
Yeah, so
ultrasound.
just do your
Test
research.
prices.
Research
Just
it,
find out where exactly you can go.
Yeah.
Anywhere close to you. Once you see anything pink, walk in
Yeah,
there.
yeah,
walk
that's
in there
true.
and
But
get
I
to
also
that.
think you know, depending on where you work, organizations can
Also do
take
that.
the opportunity because
most
they do it for
yeah,
the
they've-
women
yeah, they've done
at
it,
the
yeah.
workplaces,
Places,
churches,
yeah.
like she was
Yes,
saying.
I mean my
So
church
just
they have
take
done it.
advantage of it. October, take advantage of all
I mean,
the
October
noise.
is almost about to end. So
Walk somewhere and then get your tats checked, or you can also do the this one. Watch this video, check your breast with ginger. Yeah.
And then another thing is most people feel like because male doctors are a lot. You go to the hospital, it's probably a male doctor.
That's good.
So they don't want. They don't
Yeah.
feel
They don't feel
comfortable.
comfortable making a
Oh.
man. But most of the times, you can ask for a chaperone, and nurse will be there.
Yeah.
watch.
Or you can request. You see, patients have rights. You can request for a female doctor, or you can request for a nurse. The doctor will show the nurse what to do,
Okay.
and then you have it done. So
Yes, so
once-
don't be afraid.
Sometimes
There's no
you even get to
excuse.
the hospital and tell them that okay, I want a female doctor, and you even get one, or I want a nurse. They'll tell you this is what you have here, so go with it.
Me, I've
we don't have so much like option at the
that's not
hospitals in
supposed to be
Ghana
so,
here.
though.
Yeah,
it's
no.
not supposed to be so you can ask for a chaperone. Let a
Yeah.
nurse be there, so that
You feel
so you have no
comfortable, yeah.
excuse.
Me, I've
to-
had a female
check
and a
your
male
breast.
do it, and I will gladly tell you they were both uncomfortable. So I don't know if it makes a difference.
Yeah.
It was weird
The
regardless.
important thing is you do get it
Yeah,
checked
just-
out,
yeah, just-
so that prevention is better than cure.
Sure, yeah.
Prevention
Yeah.
is better than cure. Okay,
Any
guys.
detection saves
So-
lives. So
This has been the time with Dr. Steven.
Very
Thank you
educational.
so much for coming through. And this
Thank
has
you too.
been an educational
Yeah.
show.
or when you see Ginger in town, you can just ask her to.
to do it.
I'm gonna do it for you, ladies. Come find me.
Okay, guys. Until we meet again next year, same month.
Talk about breast cancer.
Again, yeah. Make sure you get tested. You can do the self-examination. You can go to get your screening and all of that. Please, let us live healthy so that
Cut down
we
the
can,
alcohol.
We can prevent this cancer. There, yeah. Some sickness.
Cancer
So
is
actually,
crazy.
it's crazy. Okay, guys, I've been your host. We'll meet again on another episode. Thank you, Doc, so much
Thank you too.
for coming. Thank you to my panelists. We are out.